Welcome back to MedEd 360. Today, we're exploring one of the most critical aspects of modern medicine, primary prevention of cardiovascular disease. This is about stopping heart disease like heart attack or disease like stroke before it even starts, using evidence-based guidelines from the American College of Cardiology, American Diabetes Association, and European Society of Cardiology. Whether you're a doctor, student, or just curious about heart health, stick around for practical advice you can use every day. Primary prevention is the proactive approach to reduce the risk of cardiovascular disease in individuals who haven't yet experienced events like heart attacks or strokes. The primary prevention is immensely crucial because CVD remains the leading cause of death globally, accounting for over 18 million deaths annually. By intervening early, through risk stratification, lifestyle changes, and sometimes medications, we can significantly reduce morbidity and mortality related to cardiovascular disease. So in essence, prevention isn't just about living longer. It's about living healthier, too. Now, once we got to know the importance and the burden of cardiovascular disease, it's time to dig deeper into it, and let's start by understanding and addressing the modifiable risk factors for cardiovascular disease. Modifiable risk factors are those that can be changed or managed or treated with interventions, and in return decrease their ability to inflict damage to the body. These modifiable risk factors for cardiovascular disease include 1. Hypertension, often called the silent killer. High blood pressure increases the risk of heart attacks and strokes. 2. Diabetes mellitus. In diabetes, the poor blood sugar control accelerates vascular damage. 3. Smoking. It increases the risk of coronary heart disease by 2 to 4 times. 4. Dyslipidemia or abnormally high blood lipids, especially the elevated LDL cholesterol, is directly linked to atherosclerosis. 5. Obesity. With excess weight, particularly central obesity, raises the risk of hypertension, diabetes, and cardiovascular disease. 6. Physical inactivity and poor dietary habits can lead to increased risk of cardiovascular disease. Apart from these modifiable risk factors, there are some non-modifiable risk factors which include increasing age, male gender, and family history of premature cardiovascular disease. Now, after defining the risk factors, next comes the process of risk stratification, which simply means to classify the population into categories based on the level of risk they are at, and then manage them according to their proposed risk. Risk assessment is foundational in deciding who needs preventive interventions. Here's how it's done: by the use of risk calculators. 1. Pooled cohort equation, and 2. Score system. The pooled cohort equations, PCE, are a tool that uses 9 factors to calculate a patient's risk of atherosclerotic cardiovascular disease over a 10-year period: age, gender, race, cholesterol, blood pressure, smoking history, diabetes, and hypertension treatment status. The PCE generates a risk score that classifies patients into one of 4 categories: low risk when 10-year atherosclerotic cardiovascular disease risk is less than 5%. Borderline risk is when 5%. Intermediate risk is when 7.5% to less than 20% risk, and high risk is when 10-year atherosclerotic cardiovascular disease risk is 20% or more. Pooled cohort equation, used by the American Heart Association and the American College of Cardiology, estimates the 10-year risk of atherosclerotic cardiovascular disease in patients aged 40 to 79. Meanwhile, the SCORE2, used by the European Society of Cardiology, is a similar tool in Europe that emphasizes lifetime risk, especially in younger patients. Ultimately, these sex and race-specific tools helps physicians and patients make decisions about how to reduce the risk of atherosclerotic cardiovascular disease. It can guide recommendations for lifestyle changes, statin medication, and antihypertensive therapies based on the individual risk. Okay, up until now, we have discussed the risk factors and the risk stratification for cardiovascular disease, and I hope all of you are learning these essential concepts as I have tried to explain them in the most simplistic way possible. Now comes the lifestyle modifications, or the lifestyle changes that we can adopt to reduce the risk of cardiovascular disease. These are the first line of defense in almost all the risk categories, which makes them essential. The important lifestyle modifications include 1. Diet. 2. Exercise. 3. Weight management. And 4. smoking cessation. Let's dive a little deeper into each of these lifestyle changes, starting with the all-important diet. A heart-healthy diet such as the Mediterranean diet or DASH diet, also known as Dietary Approaches to Stop Hypertension diet, is recommended. By following such a healthy diet, there will be a decrease in LDL cholesterol or the bad cholesterol, reduction in the inflammation and atherosclerosis, and also a decrease in the blood pressure. This heart-healthy diet consists of an abundance of green leafy vegetables, fruits, whole grains, nuts, olive oil. In addition to these good food, equally important is to avoid processed foods, trans fats, baked goods, and artificial sweeteners and drinks. Let's talk about physical activity. Aim for 150 minutes of moderate intensity exercise per week, like brisk walking or cycling, or 75 minutes of vigorous exercise per week, such as running or swimming. If you are still here, enjoying and learning at the same time, kindly subscribe to the channel and like and share this video to your friends, family, and colleagues, as this knowledge is essential for our health and life. Thank you. Now, let's discuss weight management. Maintaining a BMI or body mass index between 18.5 to 24.9 is important, as this is associated with a lower risk of cardiovascular disease. Weight should be managed with a diet adjusted to loss weight and increase the level of physical activity and avoiding sedentary lifestyle. Now comes last but not the least, an immensely important lifestyle change, in fact the most important change anyone can bring in their life for a better health. Smoking is a major modifiable risk factor for CVD, so quitting is essential for heart health. Smoking cessation can be done with the help of counseling sessions, which can be supplemented by pharmacological therapies, including nicotine replacement therapies, NRTs, like patches, gums, or lozenges. Other drugs like bupropion and varenicline are effective for tobacco cessation. Here we are going to discuss when lifestyle isn't enough, especially for many high-risk patients. In these patients, lifestyle modifications must be paired with medications to effectively reduce cardiovascular risk. We will discuss in depth each of the following, including hypertension, diabetes, and high lipid levels. Number 1. Hypertension management. The management starts with the counseling and education. Educate patients on how high blood pressure causes strain on the heart and blood vessels. Stress adherence to medications, as they often show no immediate symptoms of improvement. The target blood pressure goal, according to ACC, AHA, and ESC, is less than 130 by 80 millimeters of mercury. After that comes the pharmacologic management. First-line options include ACE inhibitors, lisinopril, angiotensin receptor blockers or ARB, losartan, calcium channel blockers, amlodipine, thiazide diuretics, for example hydrochlorothiazide. Okay, so let's discuss now diabetes management now. Like hypertension, its management starts with counseling and education. Highlight the link between uncontrolled diabetes and vascular damage. Promote lifestyle interventions like carb counting and structured exercise plans. After that comes the pharmacologic management, which includes metformin, SGLT2 inhibitors, for example empagliflozin, GLP-1 receptor agonists, for example liraglutide. Let's talk about lipid management. Explain cholesterol's role in plaque buildup in the vessels. Encourage regular lipid panels to monitor progress. After that, pharmacologic management of high lipids levels include medication like statins, ezetimibe, PCSK9 inhibitors, for example evolocumab. It was all about the primary prevention for today. Taking these proactive steps, whether through lifestyle changes or appropriate medications, not only reduces your risk of heart disease, but also ensures a healthier, longer life to cherish precious moments with your family and friends. Remember, prevention is the foundation of a fulfilling and vibrant future. Start today and embrace a life filled with health and happiness. Thank you for watching. Remember, your heart health is in your hands. Start making small changes today for a healthier tomorrow. Don't forget to like, share, and subscribe to MedEd 360 for more simple, life-changing medical insights. Together, let's make prevention a priority. See you in the next video.